Hello everybody, this presentation is going to be on evidence-based practice of animal-assisted therapy. So first I'm going to be going over the introduction of animal-assisted therapy. Problems encountered in personal practice include patients having an increased level of stress, issues with coping, higher levels of pain, especially if it's post-operatively, and another issue is patients don't always want to use pharmacological interventions. Individuals want to try alternative methods to see if it will help their pain or psychological issues. Rationale. This topic was chosen because personally I love animals and I think they can have multiple benefits when incorporating them in patients' care. There's also a high need for alternative methods in healthcare. Here is some supporting evidence to show the need for this project. So in 2017, 10,500 children under the age of 14 will have a new diagnosis of cancer. When diagnosed with cancer, there is also notable psychosocial challenges for the children as well as their families. And then going away from cancer diagnosis, there's also surgical procedures and hospitalizations overall can cause individuals to feel pain, fear, boredom, and helplessness. The purpose of the presentation is to discuss what literature is saying about animal-assisted therapy and thoughts on whether animal-assisted therapy should be incorporated into practice. The research investigates whether the patient's moods will change when they interact with the therapy dogs and see if there's a need for a therapy dog in the environment, such as stationed in hospitals. It will also examine the effects of animal-assisted therapy on stress, anxiety, and healthcare-related quality of life for children diagnosed with cancer and their families. And then it will also see if in the post-surgical period, if it will change the children's response to pain and stress. Next section is the research question. The PICO question was, in patients that are in a healthcare setting, how effective is animal-assisted therapy compared to standard care in helping relieve pain, stress, or improve psychological impacts after surgery or major diagnosis such as cancer? So the population was patients in a healthcare setting that had surgery or received a overwhelming diagnosis such as cancer. The intervention was receiving sessions of animal-assisted therapy. The comparison was animal-assisted therapy versus having standard care. And the outcome was to see if there was any improvements in psychological impacts or changes in pain and stress. Next is literature search. In order to find 5 peer-reviewed articles that were related to animal-assisted therapy, the Discover tool was used off a PA College website, and then animal-assisted therapy was searched initially, which found a lot of results, almost 90,000. So then an advanced search was ran to help eliminate some of those results. So patients and animal-assisted therapy was linked, which helps to include both of the keywords in the article. That found 19,000. So then another search was ran that included patients and animal-assisted therapy and pain and psychological, which found less than 1,000 results, which is where the articles were found. Also, during the advanced search, it was selected to have articles within 5 years to make sure they were up to date, and also to include full text only and peer-reviewed. Due to there being a lot of research on animal-assisted therapy, the studies had to be looked over and figure out which studies best suited this project. So the rationale for choosing the 5 articles included that the titles were appealing, the abstracts made sense and were related to the topic. They met requirements of the project, meaning that they're peer-reviewed and less than 5 years old, as well as the research was easy to understand and the results were able to be interpreted. Reflection of the literature search process, whether it was easy or hard, I thought it was a little bit of both. So some positive things was that there were similarities in the findings of the research articles. Many of them are very similar. There's a lot of research done on animal-assisted therapy, which it wasn't a tough topic to find the articles. Negatives was due to there being a lot of articles found. It was time-consuming to go through all of the different articles to see which ones were best suited. And some of the articles were hard to understand how they were evaluating the participants, and it can be confusing when looking at the results. Next is literature synthesis of the 5 peer-reviewed articles. So the first article was postoperative benefits of animal-assisted therapy in pediatric surgery. So the research used a quantitative method to help investigate whether it had an impact on the patient's stress and pain in the post-surgical period. The results showed that there was changes in cerebral oxygenation, vital signs, EEG activity, and pain ratings. Patients reported lower pain perception related to after they had a session of animal-assisted therapy. Compare and contrast Calcaterra et al. 2015. The researchers utilized random selection to help select participants. There was a specific age group, 3 to 17, utilized, which there was also a specific age group in McCullough et al. And Silva and Alcerio's research. This research article, particularly, the participants underwent a surgical procedure and then were evaluated in the immediate postoperative period. This is the only one that had to do with postoperative pain and stress. This research article used one therapy dog in their therapy sessions, and the sample size was only 40 based off of dog availability. This was the only one that's how they figured out how many participants to utilize. Reflection is that this research was easily synthesized because it was easily understood and thoroughly explained throughout the whole article. Effects of animal-assisted therapy for pediatric oncology patients and their parents. This was a random selection study, evaluated newly diagnosed cancer patients aged 3 to 17, and as well as their parents to examine if animal-assisted therapy had any impacts on stress, anxiety, or healthcare-related quality of life. The results showed that there was no significant difference in the control and experimental group for the patients. However, there was a difference in the parents' intervention group, showed a decline in parental stress. Compare and contrast McCullough et al. 2015. This was a quantitative study just like the other 3 articles, except White et al., which used qualitative data to help do their study. This was conducted at 5 different hospitals, which varied from the other 4 articles that were based out of one location. This study utilized a therapy dog in their sessions, which all the other articles also used a therapy dog as their selected animal. This article had the largest sample size out of all the other research articles. The rest of the studies had 40 or less participants. This study included individuals diagnosed with cancer. The only one that didn't include cancer diagnosis is Calcaterra et al. 2015 that focused on postoperative pain. And there was no differences in patients in the control group or experimental group. This is the only article that didn't find any changes between the 2 groups. Reflection on literature synthesis. This article was very easy to synthesize, no issues. The only thing was that I had different opinions about it because the child or parent was involved in collecting the data, which could cause some faulty results. They were in control of taking blood pressure and heart rate. And then there was also multiple different facilities, which could change why the standard group and control group had no differences because they're going to receive different care at a different facility. Changes in mood of palliative care patients in Japan. The researchers utilized convenience sampling to help investigate whether there was any change in mood after interacting with a therapy dog. The results showed that after interaction there was a significant difference in mood. It changed into more cheerful mood after the interaction. Compare and contrast Kumasaka et al. 2016. The researchers utilized convenience sampling, which was similar to Silva and Osorio, which also used convenience sampling. The rest of the 3 studies utilized random sampling methods. The experimental group could interact with the therapy dog anytime they wished. This is completely different from the other 4 articles where they would have timed therapy sessions where they could interact with the dog. The article had a small sample size, which was pretty common for all the other research articles to have less than 40. The face scale was utilized before and after interaction with a therapy dog. This was also utilized in 2 other research articles, Calcaterra et al. And Sylvie and Osorio. And there was no age group or restrictions as far as participants. Reflection on the synthesis was that it was a little challenging to read and understand the research article, but after time the research results were understood and that it was very detailed and headings made it easier to help synthesize the article. Animal-assisted therapy and counseling support for women with breast cancer. The researchers utilized a qualitative study design to help explore whether it was acceptable to have an animal present during their counseling sessions. The results were that the majority of the patients had a positive experience and made comments such as positive anticipation of therapy, higher levels of comfort, and a better chance of engagement and personal disclosure. Compare and contrast White et al. 2015. The researchers utilized random selection to find participants, which is similar to McCullough et al. 2018 and Calcaterra et al. 2015. This was the only research article to utilize qualitative research design, which then they had to use all subjective data from the participants, not objective data, and that each interview was recorded with participant consent and transcribed verbatim. This was because it was qualitative. It helps to increase validity and reliability of the research. Reflection on literature synthesis. This article took a little bit longer to synthesize due to reading through all the subjective data, and it was a little bit different to synthesize compared to quantitative research, which was like all the other research articles. Impacts of an animal-assisted program on physiological and psychosocial and oncology patients. The researchers used a quasi-experimental design to help evaluate whether there was any changes in psychosocial, physiological, and quality of life indicators in 24 children diagnosed with leukemia and solid tumors. The results showed that there was a decrease in pain, irritation, and stress, and there was a tendency to go towards improvement of depressive symptoms. Compare and contrast Silva and Osorio 2018. In this research study, there was more than one dog involved in the study. They included a Labrador Retriever as well as a Golden Retriever. All of the other studies only involved one dog. There was a small sample size of 24 children, which was pretty common for all the other research articles to have less than 40. There was only one research article that included 106 participants, which was a large sample size. The research article utilized convenient sampling. Another difference was that there was multiple animal-assisted therapy sessions in this article. It consisted of 3 30-minute sessions, and this varied from all the other ones because they only had one session and then were evaluated. Other than Kumasaka 2016, where the participants could interact with the dog whenever they would like. And this research, the participants had a particular age group ranging from 6 to 12 years, which Kumasaka et al. And White et al. Was the only one without a particular age group. Reflection on literature synthesis. This research was very easy to understand. It was well divided by headings, and it was a quantitative research design, which made it even easier to evaluate. Next topic is practice recommendations. Evidence summary recommendations. The issue was that patients were having increased stress, pain, anxiety, and change in healthcare quality of life. The research basically indicated that there was a need for animal-assisted therapy sessions or for a therapy animal to be stationed at hospitals and outpatient facilities. The following are conclusions made by the researchers in the evaluated research studies. Therapy dogs offer a novel and useful complementary therapy for children undergoing surgical procedures. Effectiveness of animal-assisted therapy can promote the physical, mental, and emotional well-being of children undergoing oncological treatment and the humanization of the hospital environment. Patients who like animals require an environment with animals, an environment where they can interact with them at any time. In other words, the need for animal-assisted therapy to be stationed in the hospital. Reflection on potential issues is that therapy dogs can have a high cost because they need extensive testing and vaccines, as well as the handler needs special training. There is a lack of therapy animals. There isn't a whole lot, and there's a lot more healthcare facilities than there is animals available. Individuals might not like animals, especially dogs. They might have a fear of them due to past experiences, or the individuals might have allergies to the animals. So finally, conclusions. The research on animal-assisted therapy was done because individuals have high levels of stress, anxiety, issues with coping, as well as pain in healthcare facilities. And the research supports that post-operative patients can have lower pain perception and positive physical changes after animal-assisted therapy sessions. Research also states that animal-assisted therapy can cause changes in mood, increased comfort level, decrease in pain, decrease in depressive symptoms, and stress in oncology patients, including adults and pediatrics. And this research overall indicates the need for animal-assisted therapy sessions or an animal-assisted therapy to be stationed in hospitals or outpatient facilities. The issues that go along with this is high levels of cost, lack of trained animals, different opinions about animals, as well as allergies. Here are the references utilized in the project. Thank you for watching.